I think that's a great question, and it really gets to the heart of why we're here. I think that the different attitudes of different populations about health and health care has really manifested itself in the outcomes we get in our communities. In Tulsa, we know between this zip code we're sitting in today and one zip code north of here that there's a 14-year difference in life expectancy. So that's really inexcusable. Same water supply, same power, same services generally, same ambulance, same doctors and hospitals. What's different about those communities? For people who are struggling day to day to get by, that is, pay the rent, pay the bills, have food, get transportation, preventive health care is not rising to the top of that list. Getting mammogram screening is not just not at the top of that list. And while it's critically important, and they would admit that it's critically important, it's not as important as checking the box on the major life functions, on the basic capabilities in life. And they're working hard to get that done. And so, one of the things I'm hoping this project will do is shine a light on that need, is really help us to identify those communities, those components of our community that are struggling in other ways that are preventing them from focusing on health, and then help us. This project also helps to provide some interventions. First of all, the ability to find folks who need assistance, who need help, but also to marry and match resources with those folks. Those folks who seek care in our community, who have good insurance, they get pretty high quality care. But the reason our numbers are so low is because a vast population here has no access to care and has no background to understand what health care they might need and benefit from. That's one of the important outcomes of this effort. I also think that there's a tremendous opportunity to support a whole new kind of healthcare delivery. With community-based health workers, with more caregiving being done in the home because of this interconnectedness, because of the ability to communicate with providers 24 hours a day, 7 days a week. Folks will be more comfortable delivering care at home. And so I think that that's going to have a lot of implications for the overall cost of our healthcare system. I always say to people, this project probably won't decrease the amount of healthcare spending that goes on in our community, but it's going to decrease the amount we spend on each person because we've got a lot of people getting no care at all and a lot of people getting way too much care. We don't want to take away that way too much care, but I would hazard to say most patients who, given the opportunity of not having to go to another doctor visit and pay another copay, would want to avoid that visit. And that's the opportunity we're giving, to right-size the care.